It's lovely to see a big crowd here, almost close to 120. I'm looking forward to have this insightful discussion, insightful orientation, and introduction to art therapy. As Darun rightly pointed out, I am Ms. Dani, a counseling psychologist. I've been in this field for the last 5 years. I have a certification in art therapy from the Indian Institute of Psychology and Research, Bangalore. Apart from that, I've also been inculcating art and art based techniques in my practice. We will be using the chat section to interact with personal messages with each and every one of you. So we'll be keeping the message box open, and at the same time, we would also allow you to unmute yourself and ask questions if any. Before we begin the session, I want to understand what is the expectation for this 1 hour. When you registered for this 1 hour program as introduction to art therapy, what is that you expected to learn from here? You can quickly drop your expectations in the chat section. If you have to reframe it, think about it like, I wish I would learn this in the session. I wish that I would take away this in the session. What would be your wish for the session today? Someone has said about analyzing emotions and how you could deal with mental health issues as a student counselor. Aspect of art therapy to understand if you could take a full-time course, to connect with kids, absolutely, to build self-awareness, learn the basics, to understand how art heals, to release and express emotions, to understand what exactly art therapy is. Relaxation. I think most of your answers are based on upskilling yourself as a therapist and also to connect with your clients on a one to one level and one to many levels. Apart from this, I also understand that few of you are interested in taking and learning art therapy as a full time course. Some of you would want to understand art therapy more for self awareness and self development. I think most of the students here, or most of us here, when we took psychology, the first question that we answered of why you chose psychology is that I want to help people. How many of you answered this when you were asked the first time, why did you choose psychology? Raise your hands or give me a thumbs up. I think the half of the class here have answered this question in a way, right? But how many of you realize halfway, bro, I need more help than helping others, right? Fortunately or unfortunately, half of us, halfway through the course or halfway to our education, we realize that we are the ones who need more help than helping others. And that's exactly how psychology or therapy works. It comes with self awareness. I had a teacher who'd always talk to me about, Dani, no matter what, no matter how many times you upskill or how many courses you take up, different theories, CBT, DBT, REBT, no matter what you learn, unless and until if you're not working that out on your own self, unless and until you would sit down and do that for your own self, you never implement that to your client. Imagine you are standing in front of a big rocket. And if you have to fix the rocket, there's something wrong with the rocket. What is that you would need to fix the rocket? There's a big rocket which is in front of you, and there's a problem with the rocket, and you need to fix it. What will you do to fix that? You can unmute yourself and answer, and I'd be very happy if you could turn your videos on. I don't want to be the Dora the Explorer for the rest of the class. You know,
I
Dora,
didn't
it asks,
say rocket science. I don't know.
you don't know rocket science, so you probably wouldn't know. Okay, someone said, oh, right answer, well attempted. Understand the problem, root cause, call an expert, right? I think If you have to replace a rocket with a car now, what would you do? All of us would immediately open the bonnet and just look at it, even though we wouldn't know anything about the car, even though we wouldn't know anything about the engine, even though we wouldn't know anything about how the structure works. We would just like to open it and look at it and see what's happening. Is it everything in place? And the next thing would be to call an expert, right? And if that expert comes and fixes the problem, we would pay key attention to what the expert is doing, probably a mechanic. The next time we would try and attempt to fix the problem on our own. And for that, we might need some tools, basic tools like a spanner, a stepney, something as simple as a glove, which will help you to open the engine if it is really, really hot. And that's exactly how psychology or your tools work. No matter how many tools you have in your toolkit, if we don't know how exactly to exercise them, it is all a waste. As an expert ourselves, we need to rightly understand how well we could communicate with ourselves and to the client. We're all here, and the world is in fast tech communication era. 50 years before, if you need to talk to someone, it's in the form of letter or a telegram. But right now, it's just in a fingertips away. We can type a message, and most of the proposals these days happen over a phone or the internet. But do we think that communication is only all about typing a message or writing or opening your mouth and talking about something? Yes? No. Do you think communication is ultimately boiling down only to talking, only to writing? Absolutely, no, right? There are different methods and modes of communication. To draw an example, imagine it's a Sunday and your friend is over at your house. You are watching a nice movie, you're eating food, and after a while, your friend goes like, "You know what? Can we go out to my house and watch something else there?" And then you look at your mother and ask, "Can we go there?" Your mother smiles at you, smiles at your friend, and tells that, "Oh, it's up to you. You guys can have fun." And then your mother stares, rolls her eyes back at you, and gives you a deathly stare. What does that mean now? It's an absolute no. Your mother wouldn't want you to go out. She would want you to stay in. You're thrashed if you go out with your friend. Even though her words say that, no, it's absolutely no problem, you can go and come back. But then the look or the body language would say otherwise. This is only one small fragment or an example of how communication would mean completely different things if not for the words. So, what are the other modes or mediums of communication? One is body language, as we pointed out from our example. What could be the other modes of communication? Eye movement, facial expression, wonderful, well attempted, postures, creative expression. Simran, I think that's absolutely wonderful that you pointed out as creative expression. But what are the factors that come under creative expression? Poem, yes. Music, poem, movement, art, literature,
Doodling,
dance, singing,
doodling.
doodling, all of it, right? These are all different forms of expressing, and this is creative expression. But how would art as a therapeutic medium enable creative expression is something which we'll be answering today. I would want all of you to answer this question. Are you an artist? Or in more certain terms, are you a drawer? That's how they refer this
Yes,
word in school, right? How many of you say yes and how many of you say no? Surprisingly, most of your answers are yes, which I'm absolutely happy and grateful about. And 20% to 30% of the answers are no. Imagine the very first time you had to draw something. What was that about? The very first drawing that all of us made in a pen and paper and in the computer is a house, a mountain in the background, a stick figure of our family, and there is this coconut tree and small coconuts, and definitely, yes, a V shaped crow on the top of the clouds. A sunset scenery, absolutely. Most of us drew this. Eventually, when we ended up being in school, we continued to draw, but then by the end of the school, we started comparing our artwork with the others, and there is a lot of judgment. My artwork is not as good as yours. I'm not that good an artist. I would not want to show what I have drawn. And eventually, there come a lot of inhibition of we wouldn't be willing to share what we have done or drawn. And it all boiled down to scribbling in the last page of the notebook. And that's all that we did. And after a point, we even stopped writing. Unless and until if it's a work or an assignment or an exam, we don't write anymore. Our expressions have stopped distinctively. But I would want all of you to go back to when you were 3 or 4 years old. Imagine you were very small and tiny, almost 1 feet, not even a feet. When someone gave you a pen for the first time, what did you do? Paint, draw, scribble? Absolutely. We went around scribbling in the entire house. If you have a niece or nephew, you could notice that the walls in their house are scribbled absolutely almost to their heights. And not certainly. Phone directories, almost in all the possible places we scribbled. And that is about expression. That is about being an artist. As an art therapist, we would not focus on creating the product, how it looks in the end, but rather about the process. Imagine again when you were asked to draw or color a carrot in first standard, you'd be given prize based on if you're choosing the right color to color the carrot or if you're choosing to color between the lines of the carrot. That is a product. Based on what your end results are, you're given prices. But in art therapy, we focus predominantly on the process. How does an individual feel while they are doing something? How does an individual feel while they are scribbling? How does an individual feel while they are trying to put something out into the paper? So, yes, all of us are artists if you can just hold a pen and scribble. Here is a technical and theoretical introduction. This session for the next 45 or 30 minutes is solemnly dedicated to give you a brief introduction and theoretical background about how art evolved as a therapeutic form and one technique which you can use. This is a definition of art therapy according to the American Art Therapy Association, which in general talks about who are the people that you can work with. The population could be individual, family, group, school, corporate, or age group of different settings, and it primarily focuses on emotional self expression and managing emotions. Significant psychological areas that can be worked with art therapy is again done in the forms of collaboration. It is it is a creative process wherein you can apply it anywhere and anytime provided that the diagnosis or the area of problem is certainly evident. Coming from the history of the art therapy has been there even during the prehistoric time. As we spoke about communication in the beginning of the session, early humans communicated in the form of cave painting, symbols, gestures, and different possible syllogisms through which they communicated. Coming to the psychological history, the first person in psychotherapeutic to use art as Freud and Jung. Jung, who eventually wrote a book on art therapy, an introduction to how art was discovered. In the year 1969 is when the Art Therapy American Association was founded. This is the book about Jungian art therapy. During the 20th century, most of the English speaking and European countries have saw a predominant rise in using art as a medium of expression. And eventually in England, the practice of art and development of psychology flourished. And that's when the founder of analytical psychology, Dr. Young, moved to understanding the object or psyche beyond the representation. I hope you all know about the personal history of Jung and how he developed mandala as a practice of art therapy. Jung has been personally facing a lot of distress after a loss of a death, after the death of a loved one. He was grieving. During the time of his grief, he wouldn't do anything. He wouldn't talk to anyone. He wouldn't do anything unless and until he accidentally figured out drawing mandalas in his workshop. And eventually that gave him a lot of meaning, that gave him a lot of expression. And that's when Jung figured out that therapeutic form can also be experienced in art. I hope you know the difference between therapy and therapeutic experience. Can anyone quickly help me understand or distinguish this? What is the difference between therapy and therapeutic experience? Most of us are postgraduate students here. I also see a few of you who are doctors, clinical psychologists. How do we differentiate
May I?
between therapy and
May I?
therapeutic experience? Absolutely,
May
yes.
I?
Go ahead, Ms. Cherity. Yes, yes.
So, therapy is a complete process which has preset objectives and a way of hand holding and taking it through a process. Whereas therapeutic process can be just one experience in itself, which can help in understanding the or taking the process further.
Wonderful. Absolutely. Therapy is structured, therapy is goal based, therapy is oriented, therapy is scientific. Whereas therapeutic experience could be anything, just as drinking a glass or a bottle of water could be therapeutic in nature. If you have water or a glass of water around you, I would want all of you to take it, sip it as slowly as possible, and keep the water in your mouth and swallow it as if like you would eat water. Can we do that? If your video is on, I could check, but I don't see any of your videos on. I would request you keep your videos on so that it is interactive. Try and take a water bottle around, sip water in your mouth, and slowly eat the water. Once when you're done, let me know how it felt. I assume that you have done it. The process in itself is very mindful. It feels, someone said it feels sweet, someone said it's yummy. The process in itself is mindful as we are pausing down to experience and live in the moment, which could be therapeutic. It is a experience rather than the process. So art could be therapeutic in nature, but art therapy is which is structured. Let's say that if you randomly take a pen and paper and scribble, it could be therapeutic. It could still make you feel better. But when does it become art therapy? When you have a goal, when your therapist suggests an activity for instantly or working on your anger and grief, focusing and channeling your anger and grief into scribbling, that's when it becomes art therapy. I hope I was able to distinguish this. Now, coming into the scope of art therapy, psychology is as beautiful as it is that you can take psychology like, I always like to refer psychology as dry fruits. You can take dry fruit and literally mix it with anything. Payasam, biryani, chicken, pulav. It's like it's something which garnishes and makes it better. You take food, fashion, animals, movies, literally anything and add psychology to it, it has a flavor to it. Art therapy, in significant terms, has wide and variety of spectrums in which we could perform. But for the presentation's sake, I have boiled out into 8 areas according to the American Art Therapy Association. Out of this, the first is mental health and rehabilitation, medical and forensic institution, community outreach programs, wellness centers, nursing homes, corporate structures, open studios, and independent practice. Do you have any questions or doubts in how art therapy would be practiced in these areas? You're free to drop it down so that I can answer. Since most of it is self explanatory, I thought I would not explain each sector. But if you have any doubt, ask me. I would answer it and then go to the next slide. Can we get this PPT after the session? No, sir, we would not send you the PPT. But if you're willing to join the course, if we'll be rolling out an art therapy full time course, you get access to all the materials. We would also be suggesting few books, activities. We'll be giving your own toolkit and other scope of performance as a therapist. How do you use it in corporate structures? Wonderful. Thank you, Shruti, for this question. So, the corporate sector right now conducts a lot of employee engagement programs. They call it as EEM, which is to reduce stress, to increase mindfulness, to increase productivity, to increase the job satisfaction, life satisfaction. Let's consider these are the variables. Let's say for a stress reduction session, in order to reduce the stress of the employees, you again go and talk to them about what is stress, how to reduce stress. For an hour, it is definitely not going to help. But rather, you inculcate art as a medium, as an experiential process. You make them sit and do something. You make them sit and connect with your inner child. It is definitely going to help. And I've been training for the last 5 years. So far, I have done around 200 to 250 therapy sessions, to 250 training sessions. Out of this, my most profitable training sessions has been from the corporate sector. uh, Including the blue collars, which is in corporate sectors, we have different cadres of employees, right? Right from CEOs to the basic organizations to the managers. All of these people can be subjected to art therapy, and the bracket in which you'll be paid in corporate sector is high. Considering the fact that if I go and do an art therapy session in a college or a school, the payment is less. But if I do in a corporate sector, is obviously high because of the revenue and because of the budget that they have. This is how you can use it in a corporate structure. And if you are a counselor in a corporate setting, you can conduct a lot of in-house trainings based on art therapy with the employees. How does it work in forensics? Let's say that a lot of forensic institutions like National Institute of Forensic in Delhi and Gujarat, they also use art and art-based techniques in understanding criminals' mindset, in understanding how to employ talking if they're not willing to talk, if they're not willing to express. Whenever we talk, there is this conscious filter to distinguish between our conscious and unconscious mind. But in terms of drawing, there is no filter. You just draw out whatever that you can, and it's always open to interpretation. Art therapy also has a lot of interpretive test, like a figure in a family drawing test, a figure in a person test. These are some of the tests which would help you to identify what is the reason or analogy behind it. What would art therapy session with patients having cancer diagnosis look like? So the Fortis Hospital in Bangalore right now has a lot of art-based interventions in almost all their sectors. In the pediatric ward, there would be a lot of distinct variables like depression, anxiety, stress. So in these terms, in order for rehabilitation, we could use art as a medium of rehabilitation, and you can also use art as a medium of self-expression. Let's say that we'll be doing one activity by the end of the session, such as draw your feelings. This, as small as draw your feelings, could help them identify their emotions, cope with their grief, and also cope with their bodily tiredness and fatigue, if any. I hope. Apart from house tree person test, what other art can be used as a test? There are various tests accordingly. You have scribble test, you have draw person test, you have a bird's nest test, you have few other tests which can be used in art. But I personally feel that art cannot be used as a psychometric medium, or art cannot be used as a test. I would rather focus on contemporary art therapy as a process of therapeutic experience rather than using it as a tool for assessments. So this is the difference between art therapy and art class. In art class, you focus more on just teaching them how to make certain diagrams, teaching them what to do. But here in art therapy, it is more about the therapist and their relationship, the space, the goals that we are willing to work on, how the materials are used, and how the therapist looks at the material. Let's say that we would not particularly ask the client to use only your sketch, only your color pencil. We would give them the different materials, and based on their comfort, they'll be choosing. Right from that, all of this would vary. Right. Before we move on to the last activity, which is something that I planned for the day, do you have any other question about the presentation so far? Thank you, Anisha. I see a heart. This suffices. Wonderful. Mandala art can be used for what kind of patients? Right. There is no long short rule for this. You cannot be using this for this and that for that. The medium or the whole aspect of art therapy is that it can be made and broken the way that you like. It can be used for any kind of patients. I use the mandala for all type of settings. When we use the term patient, it becomes a little complicated. As a therapist, we would only use the word client. We cannot use the word patient unless or until we're working in a hospital setting and someone is clinically or medically diagnosed with someone. We would try to refer to the word client. Right. Moving on to the next part, which is the activity part. Please take your pen, paper, your color pencils, all the art and craft materials. I hope the volunteers had already informed you about it. You can keep it ready. I would still love for you to turn your video on so that I could see you how you are engaging and participating. What is an emotion? Can none of you try to attempt answering this question? What is an emotion? I not want the psychological definition of emotion or theories of emotion. I rather want you to attempt to help me understand what is emotion to you. Wonderful. Response to a feeling, the way you feel. It's a feeling. Right. If you say feeling, then I'm going to ask you to explain the difference between an emotion and a feeling. Or I would make even more complicated. How do you differentiate thought, feelings, and emotion? How would you differentiate thought, feeling, and emotion? Expression of how we feel. Wonderful, Janani. Thoughts would lead to feeling, and feeling also focuses on emotion, right? Technically, or definition of physics, we say emotion is energy in motion. Emotion is something that can be felt in a body. I'll tell you your emotion, and you have to let me know where would you feel in your body. We feel different kinds of emotion in different parts of the body. Anger. Where would you feel anger in your body? Head. Most of you feel anger in your head. Wonderful. Where would you feel sadness? Chest, throat, stomach. Where would you feel fatigue, emotional fatigue? Whole body, head. Where would you feel love for someone? And that stomach, no butterflies you'd get in stomach. The same love, if it breaks, where would you feel that? Heart, stomach. Where would you feel anxiety? Hands, heart. Where would you feel betrayal? Where would you feel grief? Wonderful. I think all of you are connected with your body that you can immediately recall where these emotions are felt and label it. This is what we call it as awareness, emotional awareness. If we have to look at emotion through the Robert Plutchik's wheel, we have different aspects of emotion. Emotion is not primarily subjected to happy, sad, disgust, anger, or fear or surprise. I would want all of you to look in the PPT, look at the circle, and identify the exact feeling word that you have for today. I am really feeling hopeful today because I'm taking an online class almost after 4 months, and that was a lot of participant. You're engaging with me, and I feel like I'm making meaningful change in the society or the community of psychologists. Hopeful is the feeling word that I am feeling for today. I would want all of you to look at the screen and tell me what is the feeling word that you're feeling for the day. Wonderful. I could see a lot of words. Nice, that's nice. With that, we would be going to the activity with all your feeling word. Keep the feeling word in your mind. Take a paper, take a sketch pen, probably something which flows freely in your hand, a gel pen, a sketch pen, or a watercolor marker. Take something which is easy for you to hold in your hand, something which is light, something which flows. We're going to do a quick warm up before we go into the main activity. Once when you're ready with a paper and a pen, a sketch or a gel pen, give me a thumbs up. Wonderful. I would want all of you to close your eyes. Place the paper in front of you. Place the paper in the table. If you're sitting somewhere in a sofa, move to a table. Keep the paper on the table. Take a deep breath in and out. While you're inhaling, inhale through your nose. And while you're exhaling, exhale through your mouth. Take a deep breath in and out. Take a deep breath in and out. Focus on your breathing. Pay attention to your body. Focus on the emotions that you could feel. Think about your feeling word. Try to scribble this feeling into the paper. Your scribble can be anything. Remember, it's more about the process rather about the product. Try to scribble this feeling into the paper.
Whether by closing the eyes or opening it.
Keep your eyes closed. Close your eyes. There's no right, wrong, good expression of a scribble. A scribble is just a scribble. If you're not comfortable, pause, take a deep breath again, think about the feeling word, and try to get back to the paper again. Sit with the feeling, and once when you're done, gently open your eyes. I think we don't have access to share pictures here. If you could, can you please add the pictures to your WhatsApp group? Coordinator, can you kindly add me in the WhatsApp group so that I could have a look at the scribbles? We would like to talk about a few. I would want few of you to take pictures of your scribbles and post it in the group. I would also request the coordinator to add me in the group so that I could look at it before we move on to the next step. Oh, is it? Only admin could send messages in the group? Right, I'm sorry about it. I'd find a way in which you can send the pictures to us later. I would, yeah, you can. You can show it here. You can turn your video on. Yes, absolutely. Just that you can turn your video on. You don't have to show yourself. You can show
Could you
it.
see?
Not really. Just a moment. I'm so sorry, Nandana. I'm just figuring out my setting if there's an issue. Yes, absolutely. I can see it. Wonderful. I can see Asha, Nandana, Mishra, Soundarya. Thank you. You all get a star.
Ma'am, can you see my picture?
Absolutely, I can. I can. Janani, you get a star too. Oh, I forgot to give you a star from the beginning. I have this habit whenever you do something nice, I'll give you a star. How was the process when you did it? Scribbling without intention and scribbling with an intention and goal is a completely different process. Thank you, Janani. I could see us. You get a star. Relaxed, focused, relief. And exactly, this is the practical exhibit of the difference between a random scribble and then a scribble with intention. As Freud rightly said, unexpressed emotions never die. They always come back in uglier ways to haunt us. We could be feeling a lot of emotions, and that emotions could be stored in our body. Art could act as a medium and a tool to channelize these emotions and express them in healthier ways. You would have definitely learned about coping mechanisms, right? And you would have definitely learned about defense mechanism. Out of all the defense mechanism, what do you think is the most healthiest way of coping? Now the
Sublimation.
session is slowly sublimation. The session is slowly turning into net coaching on your 1 marks. Out of all the coping and out of all the defense, what is the healthiest way of coping? Sublimation, well attempted, but it's not the right answer. You have something else. Journaling, defense mechanism. So technically, using humor as a way of defense is considered to be healthy in defense mechanism. Humor and sublimation, yes, it is also a healthier way of coping, but humor has been the most healthiest way of dealing with something. In coping or in expression of emotion, how many words do you think are there in your dictionary to denote emotion? Trivia, quiz trivia, net exam, preparing you for it. How many feeling words are there in your dictionary to denote emotion? 5, 10. We know about theories of emotion. We know about different theories. We know about theory of evolution and emotion. We know about Robert Plutchik's wheel of emotion. Right. So technically, there are around 3,500 words in your dictionary to denote your feelings. You would not even believe. 3,500 words are there in your dictionary. Out of all of this, what is the healthiest emotion? Let's see who can get this answer right. Trivia question 3. Out of all the emotions, which is the most healthiest form of emotion? Happiness, laughter, gratitude. Chintu, you answered it right. You get 2 stars. Gratitude is considered to be the most healthiest form of emotion. As a therapist, we would try and channelize. We don't term it necessarily as positive or negative emotion. We try to term it as emotions which hurt us, emotions which leave a residue, emotions which is difficult for the client to process. We try to enable them and channel them into more healthier ways. Your drawing was in gratitude? Wonderful. You get a star for that too. This is the activity for today. We are going to focus on drawing our feelings, drawing our emotions. I would want you to recall an incident or recent emotional meltdown or a breakdown that you had. For example, I had a meltdown last week because my pet peed on my bed. I have a small pet. I am currently pee training him and potty training him. He trains to sleep with me on the bed. And that day he peed on the bed where I lost all my calm and cool. I got absolutely furious and upset and helpless because I just couldn't do anything. I love my pet, and yet at the same time, my pet has caused a distraction which I'm not happy about. Post that, I had a meltdown, which is a big, good cry for an hour. The feeling or the point about this example is that we would not, if our client comes up with a situation like this, we wouldn't say crying is pointless, you should not cry about this, it's just a small thing. We would not invalidate their feelings, we would try and validate their feelings, right? How do we validate it is way that we will looking at. So I want all of you to think of a situation wherein you had a meltdown or a breakdown or a difficult emotion, not necessarily a meltdown or a breakdown. It was very difficult for you to process that emotion. What was it? Think about a recent scenario. Even if you can't think about that feeling, think about the situation. Once when you're able to recall and point the situation, give me a thumbs up. I hope there's nobody here in this room without any problems. Oh, life is full of problems. Wonderful. All of us have identified and explored. Let's close our eyes again. I would want all of you to sit in the moment, try and take a deep breath. Go back to the situation. Think about what clothes you were wearing on that day. Think about the temperature of the room. Think about your body sensations. How did your head feel? How did your foot touch the ground on that day? What did you have in your hand? Were you sitting? Were you standing? What was your bodily reaction? Think about your feelings and pay attention to the emotions that you're feeling. Pay attention to the sensations that you experienced. Were you feeling rage? Were you feeling anger? Were you feeling love? What emotion were you feeling? Once you're able to identify and label or imagine about this, try not to give them names. Gently open your eyes and give each feeling a structure. For example, I am going to take the color green and draw my upset in triangles. It could be any size, any shape, any figure. If your emotions could have a figure, if your emotions could have a structure, what structure would that be? I would want you to pick a color for your emotion and gently put that down to the paper. The structure can be fluid, yes. It is completely up to your choice. What color would this emotion look like? What is the shape of this emotion? Form, weight, temperature. You try then put it down to the people as the closest. While you're doing the process, try and be in touch with the feeling throughout. I'm going to quickly share something so that Right. I hope all of us were able to stick for that emotion for the last 5 minutes, and I hope all of you were able to do that. Pen it down to the paper. Can you quickly show us, show your output? Right. I could see Soundarya. Thank you. You get a star, Soundarya. Chanini, I could see us too. There's a blob of emotion, different aspects to it. I'm going to stop sharing my screen so that I could see all of you in one place. Kanchan, Abba, Deepaka, Shivangi, Shivamatra. Hi, Matra. Abba, I could see Vanmati, Asha. I could see all of your work. That's absolutely nice that all of you made an effort to do that. I could see Uma as well. If you have to rate on a scale of 1 to 10 about how therapeutic the experience was, what would be your number? You have to rate about this experience on a scale of 1 to 10. You all get a star. What would be your answer? Wonderful. I see good scores where almost all of us are feeling. This is a very simple, basic technique of art therapy wherein we focus on emotional expression and channeling through art. Now, let's say that we see how we could use this article for different art therapy activity for different age group of clients. If it's someone who is 7 years old or 6 years old, we would help them identify emotion. We will help them label emotion. If it is someone who is coming with a difficulty of relationship, wherein they say that I don't know what I feel in this relationship, I feel a lot numb. I don't know if I should be okay with this or not okay with it. Let's say if it is someone from the age of 40 who's having difficulties in their career, I don't know if this is a job I want to do. I can't identify my emotion or feeling. I don't know what I am or where I am. You give and tailor make this activity for different population, which is the age group, different setting, different scenario, or different kind of issues. That is your expertise as a therapist to tailor make the program. I'll tell you how different I would use this technique. If I have to go to a class and I see most of my students uninterested, we spoke about one to one as a therapist, right? How we would use it to our client. Let's also talk about how we could use it in a group. I'm going to a class and most of the students are mostly uninterested and not engaging. I might ask them to draw this, then I might draw them for discussions. Why is that you're feeling this? What is that we could do? Then I get a number. I see a number as 4 or 5. If someone says I only feel 4, then I ask a probing question. Okay, if you have to move from 4 to 7, what is that we could do different which will help you to feel better? If they say I feel 8 or 9, then I would reinforce this activity again for them, which I know that my client likes this activity. So I'm going to tailor make it accordingly. So here's an example. And with that, I end my presentation about how and what art therapy is, introduction about it, and how you could use it. The floor is now open for questions. If you have any personal questions, you can ask in regarding about the detailings of art therapy, different population, different specific situations, we would be teaching that, we would be learning together in the detailed diploma of art therapy course. And my deepest gratitude for all of you patiently waiting. I saw 120 of you when I started the session. I still see 120 of you, which means that I was not boring. You all stayed throughout the session. Thank you so much. About the course, the volunteers would quickly, I think the organizing people would quickly let you know. We are planning to roll out one at the earliest by December or January. We would post you with the updates through the WhatsApp group and also our Instagram channel, which is IMAPS. Thank you.
Yeah,
Thank you.
so much for the session, ma'am. We would like to express our sincere gratitude for your insightful and engaging session. Your expertise and passion were evident in your presentation, and we truly appreciate you taking the time to share your knowledge with us, man. Thank you so much.
Thank you. How to identify emotions through art? See, again, there is a difference between judgment and a hypothesis. Let's say I saw a round blob in someone's artwork, right? Okay, I can't immediately say, "Are you feeling centered? Are you feeling grounded?" Asha, I saw a round in your artwork, so which means that you are grounded. I can't say direct sentences like that. I can probe Asha. Okay, Asha, I saw a circle in your artwork or in your process. Does it mean that you're grounded? What does it mean to you? I'm going to ask, I'm going to probe in order to elicit the emotion, right? It's not like gee boomba, you drew this, that's why that's what you're feeling. As a therapist, we would not make judgments, we would rather make assumptions and hypotheses and try to draw from our client. What advice do you have for someone looking to explore art therapy further? I think art came as a savior for me in my personal expression, in my journey as a therapist. That is the easiest way I could connect with anybody. So if your gut feeling says that you can be connected with art too, I would definitely ask you to pursue it. If it is something else which you feel like is your calling, I would ask you to go for that as well. Thank you, Anita, for this very nice comment about me. Right. So, Janvi, I'm very sorry that your the last activity that we did was triggering for you. I would want you to do some grounding. I would want you to write about the artwork that you did. We still have the one portion of it wherein you write about what is your process and how you can help yourself to deal with that better. What are the other techniques? Yes, in order of techniques, we have almost around 300, 400 just in the course of 5 months, which we'll be teaching you. But in the courses that we'll be teaching you, we are teaching you around 20 techniques with 4 or 5 assessments in it. The course would be online. We would provide you with a book, we provide you with resources and help you facilitate few so that you can learn something on your own and do it as well. Yes, Priya, I see you raising your hand.
Yes, ma'am. What will be the charges for the course?
I think once when the program is rolled out, they'll be able to help you answer all that question. I'm a facilitator. I take care of the classes. Once when we roll out the poster, it will have all the details such as duration, time, the syllabus, and the fee as well. You will be provided with the recording materials, certification, organization. I'm not very sure if it is UNESCO certified. This is a introduction course. It is certified by a few other bodies such as ISO and ICMR. If you have any questions related to theory part of it, I'd be very happy to answer it. If you have questions related to certification, duration, the organizers will soon get in touch with you.
Ma'am, can you hear me?
Yeah, absolutely, yes.
Ma'am, we did this activity now. How does it will work in corporate setup?
Imagine you're doing this with a group of people. The impact is profound. It would make them talk. It would make them express. Just even us being professionals, there is not a lot of time that we spend for connecting with our body and feelings.
Okay, okay, ma'am. Thank you.
Yes, please drop your question. If I could answer it, I would like to answer it. I would be happy to answer it. Not necessarily, we would not ask the client to draw in every therapy session. Since you voluntarily signed up for the course, I didn't ask you consent before asking you to draw. But if it is in a therapy session, you need to ask consent from your client. You know what? I feel that this particular technique would be very efficient for this problem or solving for this particular issue. Would you be okay to draw? We take consent from our client before executing any activity. There is no such recommended time program, but accordingly, as a therapist, the ground rule is that you would at least need 5 to 8 sessions with a client to effectively work with things. It is most beneficial for a therapist who's trying to upskill. And as I told you, all of this is not one fit all. Imagine this is like a kaftan. You can wear it as a night wear, you can wear it as a beach wear, you can wear it for outside, you can wear it for a party. It's like you can tailor make it accordingly, you can accessorize it up or down. It's up to your personal interest. The same activity can be used for a child, an adult, a couple, a family setting, a school, a corporate. One activity can be tailor made for the particular population and the problem. Not necessarily certain shapes or associated with certain emotions. Like yes, Jungian archetypes says like no shadow persona, or like I predominantly follow theories of Jungian. He denoted certain symbols with certain feelings and emotions. If in art therapy you could see a lot of patterns recurring. So based on the patterns, we make assumptions and we ask the client, what is it you're feeling? Let's say that if the client has chosen the color red, most of the times red could indicate anger or aggression, right? So we would only ask, does this red mean anger or aggression to you? But we would not directly make judgments. In terms of university, there are only universities abroad, as in like UK and US and New Zealand, who proposes a master's degree in art therapy. But in India, we do not have a specification wherein it is given as a course in the university. Art therapy is mostly used in individual counseling practices. It can be used to treat disorders. Now, see, as a counseling psychologist, we cannot be predominantly working with the clinical population, right? We can always work in collaboration. Let's say that rehabilitation center in Nemans hires art therapy practitioners for their in-house training. Someone who is diagnosed with schizophrenia, someone who is diagnosed with OCD, if they for their rehabilitation center, rehabilitation aspects, they could use it as a process or a part of the treatment, not necessarily the only treatment that they work for the disorder. It's a part of the treatment where we work in collaboration with other aspects. Right, Mishab, I'm very grateful that you chose to put this out here in this forum. This is an aspect of burnout, and I also feel this has to do a lot with motivation. I'd be happy to take this up with you post the session. No, there's no particular. There are a lot of research and scientific evidences, Soundarya. When you talk about specific anxiety disorder, you can go read up articles on what kind of activities are used for it. Mostly therapeutic in terms of grounding. So we would not particularly treat you certain specific disorders and certain specific clients, specific techniques. We follow a scientific based practitioner approach, which means that we continuously keep updating ourselves based on the current trends and areas and policies. Thank you. I think yes, that's lovely. Thank you so much for asking meaningful and insightful question. I loved interacting with all of you here. I would give the session over to the organizers to end it formally.
Thank you so much for the wonderful session, ma'am. I hope participants really enjoyed it. Isn't it, participants?
And also,
Yes.
I am available on Instagram as Petridum too. I just want to quickly promote myself, if that's okay. If you'd like to follow me, you can follow me here. But I'd be full-time facilitator in Team IMAPS, if in case. You want
Yes, ma'am.
academical help.
Great. So thank you for showering your love, participants. Thank you. Thank you so much. Have a wonderful evening. Thank you, Dharni ma'am, for handling this wonderful session for us. Thank you all.